Uh, Hi everyone, thanks for having me. So my name is Mariana. I was an ASU student. I graduated back in 2016. My bachelor's was in global health. I had actually started in biomedical engineering, and then I switched over, just kind of realizing that engineering really wasn't for me, and global health and getting the ability to study people and health from a population lens instead of that individual medical perspective really interested in me. So that's kind of the direction that I went. While I was at ASU, I did study abroad, as I'm guessing it's still a requirement. At least it was back when I was a student. So I studied in Chile. It was a program which was like traditional medicine and in like an urban setting. And then while I was at ASU, I actually worked in a mental health office. So that's where Metro MBI comes in. I did that during my last 2 years of undergrad. After undergrad, I moved to Washington, D.C., where I interned at the National Coalition on Healthcare. And then I was actually temping. So temping, if a lot of you don't know, and I didn't know this, kind of growing up, is a way of getting a job. So there's a lot of agencies called staffing agencies, and you can kind of tell them like the field you're looking for. And so I said I wanted to be in health policy, and eventually they got me set up with this organization called CAQH Core. So I temped there for 3 months and then was hired. And I stayed there for about 5 years, got a couple promotions in. And that was mostly doing health policy work around like insurance companies. So how to get doctors and insurance companies to like agree on certain things in the technology space. And then after CAQH Core last year, I left in January, and I am now working as a consultant for the Fund for Public Health New York City, and mostly working with the government agency here known as the Department of Health and Mental Hygiene. So I am specifically on the tech side of things, which I'll talk to a little bit later. And I am also getting my master's right now in public health with a focus on health policy and management. Um, so I have a few different experiences, right? A little bit of private, a little bit of government, and working in hospital systems, which if any of you have questions about that, I'm happy to answer later during the Q&A. So yeah, as I said, like for me, global health was just like a really cool way of getting to make an impact on people and healthcare without having to become a doctor or a nurse or be in that direct care setting. So that really drew me in, and policy is kind of a way of making those macro level changes. It takes a really long time, and if you have patience and determination, eventually you can kind of see those impacts hit day to day. So I think some projects that I was like really proud of myself for working on were around like prior authorizations and trying to get like national standards out, which if any of you know or have needed like a visit at the doctor's office, and the doctor was like, I can't treat you until I figure out if this service is covered and if you have a prior authorization. We try to push for like a health plan needs to tell a doctor within 2 days, and then we tried to take that to the courts. This was during the last presidency, so it was not successful, but the fact that we got people to agree on a time frame and were able to take it to this like committee and push for it was really cool. So I'm definitely a big advocate for getting in these seats, trying to do these policy pushes, and seeing where you can go and take people. So that's a little bit of like my education and background history. I know there's like a lot of skills that everyone's going to kind of touch on when it comes to like communication, leadership, and teamwork. So just diving into that a little bit. Every position that I've ever had was in a team. Like I don't know any job in the real world where you're just working by yourself. So being able to communicate with different types of people, understanding how people absorb information differently from you, I think was really important, and like being an empathetic, having emotional intelligence, if those are some things that I would say are going to be kind of like your keys to success, I would definitely say though those are it. And leadership in terms of knowing when to ask questions, knowing how to help someone out, and how to delegate work effectively. Like, hey, you have these skills, I have these skills, like let's work together to get some of these deliverables done. So I feel like being a leader isn't just taking charge and giving orders, but like working well with people and understanding your own strengths and weaknesses and how that can work with other people. In terms of like challenges I've seen and experienced at work, so if you continue on this global health and macro level work, it's very slow, at least in my field of like tech and policy. Like you're not helping people directly. So you don't get that like immediate gratification of like seeing your work done day to day. So you have to kind of just like really remember the end goal, how to keep yourself motivated, work-life balance, kind of looking at those skills to keep you moving. So everyone is different, right? And just learning your own sources of motivation, I think, are really important and something you can start learning now. Like, what's been keeping you going to complete your program? Is it the people that you work with? Is it the subject? Is it like having other hobbies and things outside of work? Like, I think those things are really important to start learning now before you enter the workforce, because it'll be challenging once you're in it. In terms of the tech side, I do think there's a lot of career growth. So every kind of aspect or facet of health is needs some sort of technology solution to make it work from like an administrative perspective. So there's a lot of growth opportunities. I'd say like some keywords for everyone to start like looking up are like project management, policy analysis, if you really like the research that you're doing, like understanding how that translates to like real world implications instead of just like in an academic setting. Those are the ways that you can kind of like set yourself up for success. So like in terms of opportunities for work, like I said, I got my job through a staffing agency, and then for my most recent role with the Public Health Fund, I was going to a lot of career fairs here in New York City. And so attending all the career fairs that you see, I did my preparation work. I would look up which agencies, which people were going to be there, and try to just already have my elevator pitch ready to go once I was there. Really helped me stand out, because if you just kind of show up to some of these opportunities without doing that prep work, it's going to be a lot harder to make it worthwhile. So I would say definitely, if there's some like key takeaways to take from this, is do your research, do that preparation, make sure that you are taking every opportunity that you have. If you're not finding them, then kind of, going back to like the career service work fairs, I would look up online like career fairs in the city, government. There's always a lot of government positions for public health people. At least in like New York City, they were looking for public health advisors, and that was a role that I hadn't heard of before. So within Arizona, right, you have Maricopa County positions. You would have ones for the city of Tempe. Then you could look up, so it's like city, county, state, and each one will have its own government agency and roles and things that you can look out for. In the private sector, websites, of course, LinkedIn, Indeed, different like boards. So there was one that used to be called like Angie's Wish List, I believe, and it was more on like the tech side. If anyone else is looking to get more into like tech startups, there's one called Built in NYC, but they do a lot of remote roles. So you can work from Arizona there. And then of course all your hospitals will have hiring within them. So At one point, I thought I wanted to work for the Mayo Clinic. So there's a lot of like opportunities there. And I've also heard Banner will have a lot of opportunities that will open up in Q1 next year that will probably be really helpful to look out for. But I think that that's it in terms of my part of the presentation. And if anyone has any questions, I'm happy to answer them. You can also find me on LinkedIn. So here's my information if you want to reach out. Karita, I'll hand it back to you.
Okay. Well, thank you. And we'll have time for questions again at the end. And so our next presenter is Danielle. And so I'll let you introduce yourself.
Sure. Let me share my screen. Oh, can you guys all see this? That's good. All right. Okay. Hello, everybody. My name is Danielle Brister. I'm currently a second-year global health master's student in Taiwan at National Taiwan University College of Public Health. And yeah, I'm really happy and grateful to be here to be able to speak to you guys about my life in Taiwan as a master's student and also the program I'm in. So I'll start off with kind of a quick intro. So I'm originally from Phoenix. I grew up, was raised in Phoenix, and I had only lived in Phoenix pretty much my whole life before moving to Taiwan. And I attended ASU from 2018 to 2022. So I graduated last year in the spring. Oops. And so while at ASU, I started ASU as a chemistry major, and I kind of just chose this major just since, you know, it was my favorite subject in high school, and I really loved learning about things that we cannot see with, you know, the normal eye. And so around this time, like around when I had started college, I joined a biochemistry lab in the Biodesign Institute, and I started to realize that my, I guess, knowledge was limited in terms of the field of biochemistry and biology. And I realized that my chemistry major, you know, wasn't enough to fully understand the projects I was working on and, you know, the overall topics. So I ended up around my sophomore year, I added a biological sciences major. And so for the first 2 years, I kind of juggled doing research, you know, in the Biodesign Institute and School of Life Sciences, and also in the School of Molecular Sciences. And it wasn't until, you know, this big event happened in 2019, you know, something that we probably would like to forget, but that is the COVID-19 pandemic. And this, you know, this thing that happened in history kind of really changed my perspective on health. And I started hearing words like human health or risk factors or incidence, prevalence, mortality, and disease modeling. And before, I had only ever thought of human health from the biological side or the chemical side. And after being more exposed to these, I realized, wow, like human health is something that is influenced by factors beyond just, you know, our biological makeup or our genetics. You know, there's environmental factors that influence the choices that someone makes and overall their health outcomes. So I wanted to learn more about the field of global health, and I took an intro to global health course. I guess it was around kind of the peak of the COVID-19 pandemic, and I realized this is something, you know, it really confirmed that this is something I want to continue and wanted to, you know, continue studying. So I ended up my junior year adding on a global health major and then also a Chinese minor, just since there's a lot of overlap, and I was studying Chinese at ASU at the time. So really kind of to get my feet wet in global health, I joined 2 global health labs through the Global Health Apprenticeship Program that SHESC has. And so I joined the Global Impact Collaboratory Lab led by Dr. Roseanne Schuster. There I worked on quantitative analysis for interviews and did some interview coding. And then I also worked in the Culture, Health, and Environment Lab, led by Dr. Alexander Brewis Slade. And that I did very kind of entry-level work by doing interview, transcript writing, and editing and things like that. And so these were really wonderful opportunities to kind of get my feet wet into global health and kind of, to see what the field was like. And so, as you can imagine, kind of by the end of college, I was feeling a little bit burnt out, juggling all these majors and, all the research projects at the time. And I also was, I was a pre-med student. So my original goal was to go right into medical school right after undergrad, and then, to kind of follow that path, like medical school, residency, and then becoming an attending physician. And I realized I kind of wanted, to see more of the world. I wanted to see places beyond just Phoenix, and I wanted to, learn more about global health, on the global scale, just since we didn't have, those study abroad programs like at the time when I was studying global health. So I turned to this office that's located in Barrett called the Office of National Scholarship Advisement. And I looked at the various scholarships or like fellowships that are offered for students that have just graduated. And they have a lot of different scholarships here that will fund you to go to different places all around the world and to study or, to do work in different fields. But one program stood out to me in particular, and that was the Fulbright program. And if you haven't heard of the Fulbright program, this was a program that was established in 1946 by Congress, specifically by Senator J. William Fulbright. And it's a flagship and international education and cultural exchange program that's sponsored by the U.S. Department of State. And you kind of go there as like researchers or professors or English teachers and all these different, academic and like scholarly fields. But the most important part of this program is serving as an ambassador for international exchange and to be able to foster relationships between your host country and then the US, foster these relationships that are real and lasting. And oh yeah, I really like this quote a lot that Fulbright said when he started the program, and it is, "Finally, the program aims through these means to bring a little more knowledge, a little more reason, and a little more compassion into world affairs, and thereby to increase the chance that nations will learn at last to live in peace and friendship." And so this is kind of the whole goal of the Fulbright program. So it's a partnership with 160 countries worldwide. They have different awards that fund you to go, and work in these different fields. Like they have open study awards where you can go and study or like pursue a degree. They have research awards where you can go and work on a research project, or you can do a little bit of both. There's also the English Teaching Assistant Award, where you can go to these countries and teach English. And then there is the Creative Part Award that lets you pursue like musical arts or visual arts or, fashion, or various things in the art field. So I ended up choosing this little island off of the coast of China called Taiwan, which is where I am right now. And I chose this because with COVID, they did actually a very good job with keeping numbers down, given their proximity to China. They had built a really strong healthcare system there, given their experience with SARS back in early 2000s. So I wanted to learn more about this healthcare system. And I also wanted to, at the same time, strengthen my Chinese skills and, learn more about my cultural heritage. So they have this specific program where you can go to National Taiwan University and pursue a master's degree. So I took a chance and I applied for this, and so grateful that I was given this award to come to here. So this is my university in Taiwan, National Taiwan University, located in Taipei. And specifically, this is the college. It's called the College of Public Health. And it is actually the first and only CEPH accredited school of public health outside of North America. And everything's taught in English because of this accreditation. And I think the really important part of this accreditation is that when you're finished with the program here, you can go back to the US and take this certified in public health exam. And then after you take this exam, then, it qualifies you to work in public health or global health after graduation. So I think that is a very cool aspect. So the first year as a student is mainly just taking the required and elective courses. So these courses are probably things you are very familiar with if you're in the global health program at ASU. I think ASU's program really prepared me very well, for these different courses. And then the second year, which is the year that I am in right now, this is like the fun year, I like to call it. This mainly entails doing research. So here's my thesis project that I've been working on. It's developing a machine learning risk prediction algorithm for pediatric allergic diseases in Taipei, Taiwan. And so I'm focusing on 3 diseases in particular: atopic dermatitis, allergic rhinitis, and asthma. And right now, there's no official consensus on the management of these allergic diseases. The climate in Taiwan is it's constantly changing. And so it's very important to learn how to develop methods to be able to predict someone's risk for this, with, pollution changing and the allergens in the air constantly changing. And so there's this database that's organized, I guess, or kind of hosted by the National Taiwan University Hospital. And this includes a collection of data from all these different branches around Taiwan. And for me, I'm specifically focusing on Taipei Main Hospital, which is right in the center of Taipei, which is where I am. But yeah, it's a very cool database with a lot of data. And then here are the different variables that I'm including in my model. So I have a lot of different biological data and genetics data, but I'm also including, parental education level or food allergies and, exposure to secondhand smoke. So trying to incorporate different factors into this. So in the end, with all this data, I'm going to develop an ML pipeline. And then after, choosing or developing this model and testing this model, I'll have a risk prediction model that can determine a patient's risk for one of these diseases. So yeah, aside from all the technical things and academic things, the overall goal of the Fulbright program is to foster the relationship between the US and Taiwan and to really strengthen that program, that relationship. So an important part of what I do here, aside from academics, is engaging with the Taiwanese culture and visiting various healthcare facilities around Taiwan. Something that's interesting in Taiwan is even in the university classes, they love to take field trips all around the country, which is something really different than the US, US university education. So here's some different photos. This is at the Ministry of Health and Welfare, and then this is a hospital. And these are just various photos that I took of my classmates. And the program is 100% international. So you get to meet a lot of different people from around the world, which is really amazing. Oh, and one thing to add on, I say that communication and leadership is something very important, especially working in a lab that speaks your second language. There can be some challenges communication challenges or cultural challenges that you may face when working abroad. So honing in those skills is very important for this. And then outside of academics, I have participated in various clubs and host family programs around Taiwan just to really engage with the culture and see what it's like living in Taiwan. So the host family program, this one has been really fun. This one I get paired with the host family and we kind of travel around Taiwan and get to try the different foods around there and go see various sightseeing and places and all of that. And then I think one of the most rewarding things about living abroad and working abroad is just the people that you meet. It's really amazing. And Taiwan specifically is a very international city. So you'll meet a ton of people from all over the world, from Asia, from Europe. It's really wonderful. And this has been by far my favorite part about working abroad and studying abroad. So in terms of career trajectory, I think, in the past 2 to 3 years, with COVID, the public awareness and interest in global health has increased overall. People are really starting to become more aware about the health choices they make and, prevention of disease and all of these fields. And then there has also been a shift in priorities. before global health kind of mainly focused on non-communicable diseases and like cancer and kind of just like the treatment of diseases. But I think there's been, or from what I've seen, there's been more of a shift towards like becoming prepared for or being prepared for like a pandemic and like ways to prevent disease and more on the prevention and preparedness side. And of course, there's been technological advancements with COVID. We kind of switched to telehealth, and so that field has really grown a lot. So there's a lot of opportunities in that area. And then of course, there's a greater emphasis on global collaboration. I think we've realized from the pandemic that one country alone cannot, solely address or solely like tackle a pandemic. They need the help of other countries. And so collaboration is huge. So many opportunities there. And then of course, public health policy. We need people to be able to collaborate with the researchers and then be able to like form policy based off of, evidence and research. So some entry-level jobs. I mean, as a student, I'm still kind of building, my career. I'm building the foundation, but these are some positions that some people in the cohort above me have gone into right after graduation. So that's like, research assistant, becoming a program coordinator, being a health educator and like working in various analyst positions and, consultant, manager, all these different positions. And so overall, these are the three main pieces of advice I would give. So one is to gain relevant work experience in college. I think a lot about like what you do in college kind of like determines the field that you work in. I mean, it really will tell you like, one, is this a field, something that you want to work in for the rest of life? Or two, like maybe it's not, and maybe you want to try something else. And then another thing is global health is a very interdisciplinary field. And I would say, I think it's very important to build skills in one area, like really focus on that one area and become really, really good at that one area, and then start to apply it to global health rather than just trying to, study global health broadly and just try to tackle all the different fields and skills. So I think it's really important to choose something that you're really good at and a field that you really enjoy and really focus on that. And then my last piece of advice is to build public health experience in multiple countries. And I think this is really important, like to approach things from a public health standpoint first, gain experience in different countries and, learn about their public health system. And then after you've gained all that experience from the different countries, then apply it to a global health perspective and, bring it to the global health landscape. Okay, so with that being said, thank you so much for listening to my presentation. Here's my contact information. Feel free to contact me anytime if you have any questions about pursuing a master's degree in global health or just about the Fulbright program, or if you need someone just to talk to in general. I'm here for you guys. And I guess we'll do the Q&A at the end.
Thank you very much. Okay, so we have our next presenter, Kristen Bustos. You should be able to go ahead and share your screen.
Okay. So my name is Christian Bustos. I'll just kind of give you a brief description of how I got to where I'm at. I graduated from ASU in 2018, and kind of how I got to my degree in global health was I was kind of all over the place. I applied to ASU in 2014 as a bio major with intentions of being a dentist. After a year or so, I just quickly found out that bio maybe wasn't necessarily exactly what I wanted to pursue. The reason being was it felt a little too micro. But with that being said, I did still want to be in the healthcare industry. So that's what led me to kind of go search and research what other opportunities I could have, but still be in healthcare. After going back and forth, I almost joined, the fashion school. I tried the psychology school, but it ended up being close. I didn't switch my major. I tried the business school, but after looking at the global health, I found that this is exactly what I wanted to do. And then it also had the travel abroad portion, which was nice. Once I started traveling abroad, I went to London. I was able to be a part of a research program, and that's when I fell in love with the degree. being able to apply everything I was learning in class into the real world really helped, me appreciate what that degree had to offer. So from that day, I started looking more into career options and what I wanted to pursue. That's what led me to eventually applying to the Herman Ostrow School of Dentistry Public Health Department for the University of Southern California. And I started as a project coordinator, and we'd go to various sites in the Los Angeles County communities and serve underprivileged families and kind of just educate them on different public health policies such as Medicare, just free dental programs, different resources that they could um, get for free. Upon leaving there, I got reached out to by a buddy of mine that I actually went to school with, which he kind of hinted at going towards the construction industry, which is where I'm currently at right now. I kind of heard his speech and wanted to see what it was about, so I ended up going in for an interview. After hearing about the company and just everything they had to offer, I ended up taking that position, which led me to becoming a project safety coordinator. This is where I kind of want to give my little piece of advice is just, not being, closed-minded to different opportunities and just using everything you've learned at school, whether it's one class or several classes that you've taken, but use that knowledge to apply it more than just that specific public health aspect or global health aspect, but see what other opportunities that may be. So I'll get into the presentation portion of that. So what I kind of do for my work is like a mixture of occupational health as well as like public health. Essentially on the day to day, I station at one job site and kind of oversee the project and their overall health and safety. During the pandemic, we actually incorporated a lot of that public health course that we actually had, dealing with, the spread of diseases, making sure they have all our infectious control policies in place, as well as ensuring that we're, utilizing those out in the field. Since we're kind of getting a little bit further from that, my main focus is now again back on the occupational safety side of it, ensuring that everyone goes home safely and making sure that, they're doing the necessary things and following all the OSHA guidelines. I do say that my position does have a lot to do with leadership and communication. We like to say that, over communicating, there's no such thing as that. Communication is very key and it's kind of what helps us avoid incidents. Pre-planning is one of our biggest things we talk about. It's talking about, our tasks for the day, what those hazards are, and then how we're going to mitigate those things. So communication skills are very key, as well as just working with different types of personalities. Being able to work with an iron worker who may not have the same background and same, I guess, thought process as an electrician or a carpenter. So just trying to build a community, and that's where your leadership aspect comes into play. Leading this large group into one common goal, which is obviously building a building, but also making sure it's done in a safe manner and no one gets hurt and everyone is able to enjoy that. So our company has 150 years of experience, and as you can see, we do quite a bit of work, and we're actually one of the #1 contractors in Southern California, and being able to do so with safety being our #1 priority. Career trajectory. We have a pretty big career. Actually, sorry. Show you guys some of our projects. So we do quite a various different things. So we do anything from commercial as well as schools. That's one of our biggest sectors, as well as healthcare, which is where I'm currently at right now. So I'm at Hoag Hospital. So our important thing about our company is to make sure that we're building things that are going to impact our communities, and that's one of our biggest ethos is to make sure that what we're building is going to impact it in a positive manner. So not just building strip malls, and that's kind of like where the healthcare and our renewable energies and school aspects come into play. We also do airports. Some rewarding aspects and just challenges that we face, and this my position and just an industry is obviously dealing with all the different personalities. But the rewarding part is at the end of the day, um, is making sure everyone goes home safely to their families. I actually have a story which kind of made me passionate about my job, which was building this relationship with this foreman. It's been a couple of years. I saw that he got promoted, and I reached out to him and spoke to him about how he was doing. And he's mid conversation stopped me and said, "I just want to let you know that what you do and what the company stands for safety wise, and caring about that is what made me want to stay at this company long term." And that when he was at his old company, he didn't feel as if they cared about him. And they were putting him in situations where it potentially was a hazardous environment. And that's what led him to actually step away from that company and return back to our company, McCarthy. Um, so, yeah, I think that's pretty much how I got my career. The rest of the stuff that I have on the slides are
Hey,
several.
Christian, could I jump in here as well and kind of talk through some of the slides? So, hi everyone. Can you hear me? My
Yes,
name
we
is
can.
Hi, my name is Kim. I work with Christian. So we both work for McCarthy Building Companies. And I manage the hiring process as well as the intern program here. Christian did a great job talking about his career path and how he got into construction safety. And I'll say, like Christian, I never thought of myself in the construction industry. So I'm really glad that you all are here on this call to learn about the various career paths that are available to you. One of the most rewarding things you had mentioned, Christian, saying is the impact of being able to ensure the safety and well-being of the employees out at the job site. So this role has a different spin on health and safety. It's more occupational health. And so we have over 700 employees in our region, and 20 of them are safety individuals. And we have one of the lowest safety ratings in the industry, bar none. And that's because of the safety programs that we have in place here. So as we talk through important things, that Christian had put up some pictures of the projects that we build. And so really just wanted to highlight a lot of those. Like, we build sports stadiums. We just finished the Allegiant Stadium out in Las Vegas. We build hospitals, which Christian is on right now, colleges, schools. So imagine you being a safety professional, being able to have an impact on some of these huge, very notable, important projects that exist in our company, in our communities. And that's the role that our safety team plays. Right, some benefits to you. This slide, we do have a lot of learning and development. So there's a lot of training that's involved in getting individuals right out of college ramped up and engaged in learning about the different programs that we have in place and how we build and the importance of building safely. Can you go to the next slide, Christian? You want to talk a little bit about this, Christian? It's just career path in the safety field. So if you look at the on the right-hand side, there's the safety career path there.
Yeah, so the career path, obviously there's quite a large career path. It initially wasn't as like that in the beginning, but I started as a coordinator and kind of learned to develop your skills, your interpersonal skills, obviously, as well as making sure that you are learning the OSHA policies. And then we are actually able to grow, and that's one of the biggest things about McCarthy is they nurture you to grow within the company, and they also provide you the necessary training and whatever you need to kind of flourish in your role, which led me to my next promotion was the assistant project safety manager, where I help oversee an entire job site. From there, you can move to a regional manager where you're kind of more on the macro side of the company and able to oversee multiple job sites. And then eventually to the director role where you're kind of dealing with the office side and the more upper management.
Perfect. Next slide. So I manage the intern program, and one of the I'll say one of the most important things that you can do for yourself while you are in college is to get real world experience. And you get that through interning. Right. So during the summer, we bring on board college students. Last summer, we had 66 in my program. Um, and we are looking for safety interns. The interns are basically going to be out at the projects. So imagine being stationed at the Allegiant Stadium, or imagine being stationed at a hotel that we're building, right? Any of those projects, but our interns will be on site with the project team. They will be walking, so they'll be doing job site walks. They'll be shadowing the team as they look, as they monitor the safety programs, doing toolbox talks, so leading a bunch of safety talks with the team, doing some task hazard analysis. They will get exposed to all sorts of real world, real life experiences on the job site. If you are someone who you don't like doing the same thing day after day after day, if you like to mix it up, if you like going to different, possibly even going to different locations, because once a project finishes, then we assign our interns or individuals to the next project, right? So every project is different, every day is different. There's a lot of dynamics in this role that's really rewarding and challenging. As well, it takes a lot of critical thinking. Like Christian said, it takes a lot of communication. But if health and safety is something you're passionate in, then your impact and significance in this role will be huge. So that's a big one. We also provide subsistence for individuals if they need to get closer to the job site or just drive to the job site. Subsistence is just additional money that the company provides. And then the other, those are a list of all of the other intern roles that I hire as well. And we do hire a lot of our interns. This past summer, we gave offers to 91% of our interns to come back and do another internship, or if they were graduating for a full-time offer. So the rates are really great. Next slide, Christian.
So taking pride in safety, this was one of the biggest key factors of kind of why I got into this industry. During my interview process, you could just tell how much McCarthy cared and about the safety of the overall well-being. It wasn't just words that they were spewing, and having that kind of support in your court is going to be really immense to what you do out in the field. And being able to spend as much money as it takes to make sure that these people are going to go home safely was really important to them as well as me. So being able to have that kind of support system and making sure that you talk to every single person, you build all these relationships with these guys, and you get to learn about their families. You really take it a lot more personal about making sure that everything you do every single day is impactful to them. And as you can see, our projects are well below the typical norm in the construction industry, so we take it very seriously at McCarthy. So here's just some of the qualities that we look for in just not only safety, but just overall company. Is collaborative, like we talked about. We're in a big team setting, although the safety department is just one sector of it. We also have to deal with different types of employees as well as field. So we collaborate within the office of making sure we have all the necessary documents, funds for certain events or PPE, and making sure that the job is running smoothly, but as well as collaborating with the field to make sure that they are implementing those ideas, or maybe even listening to those ideas that we can potentially use as a lesson learned for future projects. Being self-motivated, McCarthy does a good job of obviously, giving you your kudos when needed, but obviously using your self-motivation to go above and beyond what's asked, and making sure, like we said, once you take it personally, you want to do that anyways. Being a problem solver, being out in the field, you don't always have the most ideal conditions. You work on small job sites where you're dealing with hospitals that are live. you're next to power lines, you're next to different various, obstacles. So thinking outside the box, using your past experience from not only construction, but obviously sometimes you have different experience of coming from different backgrounds. So using that and being like going back to the initial, collaborating with different people that are on the jobs to get a problem solved. Effectively communicating. So we do have to talk quite a bit, especially in the safety role. We give out different types of speeches within either small groups, such as 5 to 10, or as large as to the entire job site. So being able to effectively communicate what you want to say, because a lot of times they will obviously start wandering off, their thoughts start wandering off. So you want to be as effective and concise as possible so that your message is heard. Eager to learn and grow. If you're somebody that wants to grow and you want to learn, this company is great, because whatever opportunity that you potentially have or thinking about pursuing, you can bring it up to anybody in the management and pursue that, whether it's a course, furthering your education, or potentially just a new idea to implement. And then lastly, just excited by the prospect of building. This is also just like a physical thing that you can kind of measure your accomplishments as well. So driving by a high school that you helped build, or a hospital, it's just pretty cool to see. And, let family members, I was a part of that, and that you impacted the community. And I believe that's the end of the slides. We can answer any questions. We also, like I said, we have Kim here, the STAR recruiter. So if you have any specific questions about pursuing something with McCarthy or in this industry, she's a great asset, and you can always reach out to her in the comments or personally on the messages.
So thank you both, Kim and Kristen. And so we'll have questions at the end. So our next presenter is Dr. Blasco.
Okay. Can you stop sharing? Perfect. Okay. So hi, everyone. Thank you so much for inviting me to take part in the career panel today, and I'm very happy to be with you virtually. I thought I would first speak a little bit about my educational background and training, and kind of highlighting some of the key turning points and opportunities that I took part in that really laid the foundation for my career trajectory. So I'll talk about also where I ended up. I just started as an assistant professor in public health at the University of Nevada, Las Vegas. And I'll end with just some broad advice, especially if you want to continue in academia. But I think it applies no matter what kind of career trajectory you're interested in. So just to give you a little bit of an overview, I've attended a broad array of institutions that have contributed to my educational training in the fields of mental health and global health. I attended ASU for my undergraduate and master's degrees. And then I completed my PhD in public health at NYU and received postdoctoral training at the University of Michigan in the ethical, legal, and social implications of genetics and genomics, which I'll talk more about in a little bit. So while I was at ASU, I completed a double major in both psychology and global health. And I was originally pre-med, like many have mentioned, and took the required science coursework to apply to medical school. But at some point I did realize that I didn't really want to go to medical school, but I still wanted to be involved in a field that looked at health. And so I would say that there were several opportunities that I had during my time at ASU as an undergrad that really prompted me to start thinking about pursuing a graduate degree. And so at ASU, I participated in both research labs and was actually able to teach undergrads myself. And so I realized that staying in academia was actually maybe a better path for me. So during my time at ASU, I was a research assistant in 2 labs, one from each of my majors. So the Adolescent Stress and Emotion Lab, which was housed in psychology and run by Dr. Leah Doan. So I'd taken a psychology class taught by her and was interested in her work and getting more involved. And so I applied and decided to work in her research lab. And then here at the School of Human Evolution and Social Change, I was involved for most of my undergraduate degree and also during my master's degree in the Culture, Health, and Environment Lab. run by Dr. Amber Wooditch and Dr. Alex Brewis-Slade, who are also my mentors throughout my whole program and on my committee for my undergraduate honors thesis and my master's thesis. And that mentorship that I received during my undergrad career, and really which extended with Amber and Alex into my master's career, really allowed me to work intensely one-on-one with really amazing academics and really changed my mind about my career path. So I give a lot of credit to these wonderful mentors, some of which are pictured here. And I also figured out early on, kind of in my undergrad career, that I really liked teaching. So I had the opportunity to both teach a class. I don't know if it's still called LA 101, but it was focused on student success at ASU. So I had the opportunity to teach that actually twice, and then to be a teaching assistant for a psychology class. And so I realized that I really liked working with students, both in a classroom setting like that, and also mentoring students one-on-one, which is something I really enjoy about my current job as well. So as I mentioned, I completed my master's at ASU too. I did the 4+1 program in global health. So I have a BA in global health and a MA in global health as well. And in that master's additional year, I continued to get more training and individualized mentorship. And I also gained other skills like in course development. I worked with Amber on the development of a couple of courses. So all those experiences and activities during my undergrad and during my master's, and have really set me on a path towards a PhD program. So during my master's year, I applied for PhD programs in both medical anthropology and in public health. And for many reasons, I ultimately decided to pursue a PhD in public health at NYU. And during that time at NYU, I really focused on social and behavioral sciences, which really brought together my interest in mental health from my psychology degree and public and global health that I had started to gain during my undergrad as well. I specifically really honed in on focusing around stigma related to serious mental illness and really the implications of identifying individuals as at higher risk to develop serious mental illness and the impacts that that might have on them. And during that time too, I was also thinking a lot along with my mentors about the implications of genetic testing for psychosis, should a widespread and readily available genetic test be utilized in the future. And I remember that was pretty early on in my PhD training that I remember talking with my mentor, Dr. Lawrence Yang, and we started talking about and discussing what might be next good steps for me after finishing the PhD. And so it was kind of in those conversations very early on that I started to focus in on thinking about stigma related to Alzheimer's disease, as well as gaining some additional sort of formalized training in what's known as ELSI, or the ethical, legal, and social implications of genetics and genomics, to really start to carve out this new space for me as a scholar, because in a PhD program, you have to sort of find your area that you're going to contribute to. So there's really only a selected number of postdoctoral programs, which I'll talk about in a minute, that focus on this sort of more niche area of ELSI. Again, the ethical, legal, and social implications of genetics and genomics. But from pretty early on in my PhD career, I kept that in mind as a target for a potential postdoc after graduation. So obviously, as others have mentioned too, the world changed drastically in 2020 with the COVID-19 pandemic, which also happened to coincide with the final full year of my PhD. I graduated in May of 2021. And so like everyone else, there was a lot of adjustments that had to be made during that time period. And one of the implications of that was the lack of hiring that was happening at the time, at least in academia. So I had to be a little bit more selective about the postdocs that I was applying to. Luckily, a few of the postdocs that I had originally targeted were still taking new postdoc fellows. And so I submitted multiple applications for what are known as T32 postdocs, which are institutional postdocs at various universities that take on postdoctoral fellows. And I ended up at University of Michigan. So just for some of you who might not know, a postdoc is additional training that people, especially in certain fields, including public health, have as an option to receive between their PhD and their next career stage. So again, it's more common in some fields than others, but as many of you likely know, tenure track positions in academia are relatively hard to come by. So many PhD recipients will engage in this sort of additional training prior to their first assistant professor position, just to have this kind of more protected time to gain additional skills and to sort of start a research trajectory. So as I mentioned, I was part of a NIH T32 postdoc at University of Michigan, again, which was an institutional postdoc program that both provided training to actually predoctoral students who are doing their PhD, so they can be funded by this mechanism too, and also postdocs like me at the time who had already graduated with a PhD, but were looking for additional training in a particular area. So like I said, I had applied for multiple postdocs during the last year of my PhD and ended up at Michigan. And so this specific postdoctoral training program, again, focused on this area called the ethical, legal, and social implications of genetics and genomics, and was funded by the National Human Genome Research Institute, which is a research institute, one of the research institutes at NIH. So as a postdoctoral scholar in the program, I received additional sort of formal training through classwork. So there were specific classes that had been developed to focus on these areas. I also received intensive research mentorship. So my advisor, who at the time and continues to still mentor me, is Dr. Scott Roberts. So he's done a lot of work that has focused on the ethical and psychosocial impacts of disclosing genetic testing results to individuals with Alzheimer's disease, so learning about their Alzheimer's disease risk and what that might mean for them. And so as part of this postdoc program, I was given this sort of protected research time to really focus on developing a unique research agenda, which included publishing papers, submitting grants, attending conferences, developing new collaborations with colleagues. But many postdoctoral fellowships are time limited. And so mine was for 2 years. So they're typically relatively short. So you have this kind of short amount of time to gain this additional training, which then helps you move to your next career stage. So I started to apply for tenure track academic jobs in the second year of my postdoc. As many that the hiring cycle for academic jobs is very long. So you tend to apply about a year usually before you start the position. So I started applying in the fall of last year. So I ended up at the University of Nevada, Las Vegas, and came back to the desert heat. I grew up for the most part in Phoenix and obviously attended ASU. So it's been a little bit of an adjustment coming back after living on the East Coast and Midwest for the past 7 years, where I experienced a lot of cold winters and snow. It's nice to have the sun again. So I'm currently an assistant professor in the social and behavioral health department in the School of Public Health at UNLV. And as part of my current position, I really have 3 main areas of my job. So these include teaching, research, and service. I'll talk a little bit about what each of these entail. So in terms of teaching, right now, actually, I'm teaching an Intro to Public Health course for undergraduates, but I'll be teaching a diverse set of undergraduate and graduate level courses over the next few years. And teaching, right, as I talked about, was one of those activities that I discovered at ASU that I really loved to do. And teaching really requires you to be able to effectively communicate materials to students so that everyone learns, right? It takes a lot of time to build up those skills to be an effective and engaging teacher. And I would really encourage all of you to take opportunities when you can for feedback on presenting, because in any job that you're going to have, you're definitely going to have to communicate with your boss and your colleagues. But many jobs you might have to formally present, right? Whether it's on new ideas or your research or anything like that. So I would really encourage you to practice presentation skills and to solicit feedback in those areas. I, for instance, been observed in my teaching and evaluated and will continue to be evaluated. And that really allows for this sort of continuous feedback and improvement. And again, I would encourage you to get experience in presenting. It helps with communication skills. I was not someone who in high school or early on in my undergrad degree loved presenting. I was shy and didn't like to present in front of large audiences, but I sort of forced myself into opportunities where I knew that I would get better at it, like teaching. And that ended up being one of the best decisions that I made during my undergrad program, and that definitely influenced my career trajectory. So that's kind of one aspect of my job right now is teaching. Another aspect is research. So I continue to work with a variety of collaborators at different institutions on lots of different research projects, some of which I've mentioned before. So I'm continuing to work in the areas of stigma and mental illness, and thinking about the implications of genetic testing for individuals and their families. My most recent research has sort of focused on the implications of genetic testing for Alzheimer's disease, but like in a new context. We have a lot of treatments that have recently been approved for Alzheimer's disease, and there are specific implications of genetic testing in this context. I've taken leadership roles when conducting research, right? So when you're the principal investigator of a project, you're in charge of leading it, right? In terms of both sort of the big picture of what you want to accomplish with that project, but also in the day-to-day operations that ensure that research moves forward. Sort of the last key area of my job right now is service. So part of my job is to mentor and advise students. So I provide both academic and research mentoring to students. So for example, I'm sitting on several master's students committees right now who are working on research theses and professional papers. And I also sit on and will continue to be part of school and university-wide committees. So for me, it's really rewarding to be able to work one-on-one with students. As I've mentioned, I credit my mentors a lot with how my academic journey has evolved and how much impact they had on my career trajectory. And I really hope to be able to give back in the same way. One of the challenging things is being an academic means you have a lot of different jobs within your sort of overall position, right? So you're a teacher and you're a researcher and you're a mentor. And so you have to be able to balance all those different aspects of your job, which can be challenging and really requires good time management. And this kind of job also requires you to be very independent and to take leadership, right, in developing new trajectories of research, including obtaining funding, right, to move your research trajectory forward. So you have to be a leader in the field. So I'll end here with just a few pieces of advice that I've put together, again, coming from kind of a recent hire as a new assistant professor. So I really encourage you to identify mentors. My mentors were all instrumental in where I ended up and really provided me with opportunities to grow as a scholar. So I would say that mentors will continue to be important throughout your career, no matter where you end up. So really seek that out early and continue getting mentorship in different areas. And engage with your mentors and keep up that mentorship relationship, because your mentors are also likely to become your collaborators one day, especially if you're staying in the fields of academia, right? But in other fields as well. And so it's important really to find groups of people you connect with in terms of your interests, whether that's in global health or anthropology or whatever your interest is, and really to form those relationships. And again, to maintain that as well. Forming connections with mentors and peers is really important for career development. Again, so many of the opportunities that I have had have come through connections with people that I've worked with. And I feel like especially in the during the pandemic, where there were so few jobs and where the job industry really changed, it was really important to have these good networks of people that can advise you and can mentor you. And the last thing I would really encourage you to do is to get as much experience as you can. So I know it can be overwhelming when you're an undergrad and you have lots of classes and you're trying to manage all these different things. But I would really encourage you to engage in opportunities outside of classes. That'll help you in terms of having sort of the necessary qualifications that you need when you actually go to apply for jobs or you go to apply for a grad program or something like that. But it'll also help you figure out what interests you, right, through different opportunities. So I had mentioned that I had worked in several research labs and taught while I was at ASU, but I also participated in a lot of various other opportunities. I completed other internships. I completed a research internship at Mayo Clinic in their emergency department. I did an internship at Banner Good Samaritan when I was still sort of on the pre-med track. I worked as a writing tutor at Barrett. I was a Tillman Scholar. I did several study abroads. People have talked about that as well. One in Switzerland, that was part of the requirements for global health, and also one in France as part of the honors college. And so all of these experiences and the wonderful mentorship that I have along the way really helped solidify my career path. And that's how I ended up where I am today. So thank you again so much for taking the time to listen and for letting me be here today. And I've left my email, so if you have any additional questions, you can feel free to reach out.
Thank you, Dr. Lesko. And we have our next presenter is Hawaya Osman.
Hi, everyone. Can you hear me? Okay, wonderful. My name is Hala Osman. I apologize for sounding super nasally. I'm feeling under the weather. Before I get into what it is that I do currently, I'll tell you guys a little bit about how I got here. I am an Arizona native. I went to Arizona State. I received my bachelor's in global health and did a minor in early childhood education, received that bachelor's in 2015. Like most of the other presenters here, I was on the pre-med route and decided that this is not something that I could see myself doing. And so I think it was my junior year at ASU, I took a course with Dr. Jacobs called HIV and AIDS. And with that course, it really opened my eyes to something that I didn't even know would be of interest to me. Part of that class was we had to do a certain number of hours in volunteering and community service. And I volunteered with an organization called Southwest Center for HIV and AIDS. They are now called Southwest Center. And during that volunteer opportunity, I was able to really make connections, which ended up landing me a job right after graduation. I worked there as a medical case manager. Initially, when I started, it was part-time. I really had to prove myself. And then I eventually became full-time within that first year. And then from there, I was able to grow within the organization and become the medical and non-medical case management supervisor. In that role, I worked really closely with individuals who were living with HIV and AIDS. And the main portion of the job was to make sure that we were able to alleviate as many barriers as we could to ensure that the individuals are reaching undetectable status. And so it would sometimes look like, making sure that they are having access to their medications, making sure that they're having ways to get to their doctor's appointments, taking care of other barriers such as food insecurities or housing insecurities, et cetera. And so after working there for about 4 years, I really wanted to grow career-wise, and I found that I wasn't able to get as many opportunities as I would have liked. And so I looked into a master's of public health, and I received my master's from A.T. Still University. I did the online program. I thought it was really easy to follow. I would highly recommend that if anybody's interested in a master's program online. Maybe it's the pandemic, I don't know, but online is definitely the way to go. The only hindrance I would say from online is you are not able to connect with your classmates the same way you would if you guys were in a classroom setting. And connecting with classmates is important because you get to really make connections. People know things that you don't know. Doors can open up for you that you didn't even know existed. And so and so from there, I took a break from working in the field and I worked for a startup, which was not something that I saw for myself, but it really helped me finish out my master's program without feeling too burnt out. And from there, I started at Kent Community Health, and I'll tell you a little bit more about what it is that I do now. Let's see if it changes. Okay. So the mission of Kent Community Health is to provide a continuum of medical, social, education services to the health and well-being of those living with HIV and AIDS, hepatitis C, or sexually transmitted diseases and other diseases to really just enhance public awareness. Kent is located all throughout the United States. We're mainly alongside all of Florida. We have a clinic in South Carolina, a clinic in Virginia, New Jersey, Arizona, Texas, and we just recently got a clinic in Vegas. The scope of our services, what I do is I oversee the prevention team. And what the prevention team does is we kind of break it up into 3 categories. We have mobile testing, we have prep services, and we have community engagement. Mobile testing, if I could go back, let me see. So this is what our mobile unit looks like. If you live in Arizona and you've been to First Friday, you might have seen us out there. What we are able to do is through this mobile unit, we're able to provide free HIV, STI, and hepatitis C testing. And the STIs that we test for are syphilis, chlamydia, and gonorrhea. We're able to do all of that inside this mobile unit. We have 2 rooms in each mobile unit, and they are completely, soundproof, private, secure. You know, we're able to do anything that we're able to do in the clinic inside this mobile unit. What is really exciting about our organization is we are grant funded to provide these testing services all throughout the state of Arizona. So sometimes my team will go out to Flagstaff, they'll go out to Yuma, they'll go out to Tucson, Winslow. Something that we're really focusing on this year is, you know, reaching the Native American population. And sometimes we're able to go out to the reservations. A big component of that would be this third category of community engagement. And that's where my team and myself will go out and create partnerships, a lot of networking, a lot of talking, a lot of communication, a lot of follow-ups, just, you know, finding ways where we can partner with different people and offer the services that we provide. And as far as prep, we are really big on education. Any chance that we get to provide education services, we take it. You know, during the testing session, our program specialists offer that education. If we see individuals that have high risk sexual behaviors and, you know, they're getting tested frequently with us, we will encourage them to consider prep. We even have assistance programs that can help pay for the prescriptions. We have grant funded programs that will help pay for the labs that are associated with the medication. So there are a lot of opportunities available for individuals should they be interested in PrEP. We have a clinic that's based on 19th Avenue in Indian School. So the way our team is set up is sometimes the team will be out doing outreach in the field, and then we'll always have a clinic tester assigned to the clinic each day. We are open Monday through Thursday from 8:30 to 5:30 and Fridays from 8 to 12. All of the testing services are completely free. The reason that these services are free to the community is because I am able to make sure that we maintain our grant funding. And sometimes that'll look like, you know, grant reporting, maintaining relationships with our funders. One of our largest funders is the Arizona Department of Public Health. And so a lot of the collaboration opportunities that we're able to do is written agreements. We're able to provide home test kits if individuals don't want to come into the clinic. We work really well with different businesses. We work well with churches and faith-based organizations. And so, yeah, let's see. So just to give you guys some advice. I don't want to be redundant because I feel like the panelists did a really great job of hitting all the major points. My main advice that I really want to echo to you all as you continue on in your journeys is to really just network and find a mentor. That's something that I did not really focus on when I was in undergrad. And I feel that now later on in my life and my career, that's something that I feel has really opened a lot of doors for me. So networking, finding a mentor, and just really putting yourself out there. Again, sometimes it's not what you know, but maybe who you know. And I feel like those opportunities can really open doors for you all. And thank you.
Thank you to all of our presenters. Wow, you all are doing amazing things and impacting our world. So we have a little bit of time. So if you have questions, feel free to unmute, or you're welcome also to post your question in the chat. And I don't mind sharing that as well.
I just want to give a quick little thank you to all the panelists, and just remind our current students that this is a really great opportunity to talk to our panelists. Again, they have some really great experience. It gave amazing advice. So don't be shy. They took some time out of their work days today to be here and to present to you. So please ask them questions. That's what they're here for.